Hi everyone, my name is Melvine Otieno from Kenya, and I'm the founder and stroke the coordinator of the Planetary Health Eastern African Hub. And I am here to welcome you all to our hub. The Planetary Health Eastern African Hub offers an opportunity to learn and share about planetary health and planetary health emergency within the Eastern African community. And we aim at stimulating regional community building and also providing education for transformative action and also push for strategic policy making in the face of the greatest planetary health emergency of our time at the moment, which is COVID-19. So I will share with you my slides in a moment on whatever I want to talk about shortly.
Amazing. Thank you, Melvin, for the introduction. Also, a warmly welcome for my side, and thank you for joining, everyone. So this is our introductory lecture. We're going to have Melvin Otieno, who is a planetary health ambassador and who is going to share with us her experiences on planetary health in Kenya mainly. And then we're also very glad to have Sam Myers from the Planetary Health Alliance joining us today for giving a first introduction to the very exciting field of planetary health. And with this, I'm giving the word to Melvin, who's going to share her experiences with us.
I'll talk about my experiences in this planetary health global network. So what is planetary health? Planetary health, according to the Rockefeller Foundation Lancet Commission on Planetary Health 2015, it describes it as the health of human civilization and the state of the natural system on which it depends on. And it is an emerging field that shares global health focus on achieving health for all population, and also emphasizes on urgency and scale. For the Eastern Africa, we can see that there are some key emerging challenges that we are facing. These include things to do with climate change, biodiversity loss, pollution, in terms of household air pollution and also water pollution. We also see that there are issues with insecure food system. We found out that our area, we are faced by malnutrition among the children and also in adults. And then we also have issues to do with gender and health inequalities and also urbanization. I would like to introduce to you about the planetary health education for the Eastern Africa. There are 12 planetary health education lenses, and these are urgency and scale, communication, policy, governance, and intended consequences, and inequality and inequity, bias, system thinking, and transdisciplinary, and also organizing and movement building, historical and current global values, and then we also have the global citizenship and cultural identity. I would like to share with you some of my experiences. I was a Planetary Health Campus Ambassador in 2019, and through this opportunity, I was able to form a club in our university called University of Eldoret Planetary Health Society. Through this, we started mobilizing the student community to register and join to participate in the planetary health movement. And these provided a conducive venue for building and mobilizing youths, and also the local community on practice around planetary health and environmental sustainability. As you can see from the picture, one of the activities that we engaged in was solid waste management effort. Together with the students and the local community, we had a workshop together with the local community, and through that we were able to see that there is need to work closely in our activities together with the local communities from around us. We also did a local conservation of a local wetland near our university called Marura Wetland. And through that, we went and also educated the local community about the benefits of the wetland. Through my opportunities as an ambassador, I also promoted planetary health by visiting other universities in Kenya, including Egerton University, as you can see in the first picture. And I also got an opportunity to become a speaker and a panelist at Berlin, and also participated in the Planetary Health annual meeting virtually, where I presented a poster and talked also as a panelist on a topic on engaging the world youth. In my visit to Berlin, I also met one of a 2019 ambassador known as Oscar. And in that picture, also Renzo Guinto, who taught us about planetary health activities in the Philippines. Some of the theory of change that I came up with after my experience as an ambassador is that when you're a student and you get this opportunity, there is need for you to form maybe a club in university so that the students can help you in the planned activities. Through this, you will be able to have community interactions during fieldwork and also network. And then the ultimate goal of all this was to encourage other institutions in the Eastern Africa to form planetary health clubs that will involve more students to participate in it. And also to allow students to engage more in fieldwork. Though during COVID-19, we have some problem, but the issue is that we are also doing online activities at the moment. So that is so good for students as well. Through the network and leadership opportunities, I would like to present for you some of the youth in Africa that became ambassadors in 2020. And then I also got an opportunity to become an associate member of Women Leaders for Planetary Health, and they've offered a good opportunity for me to learn more about issues facing women and gender inequalities. Those are just some of the leverage networks that I've been able to acquire through planetary health opportunity. And then for those who don't know where the Eastern Africa region is, a picture showing it. It has around 18 countries within Africa. What is the vision of our hub, the Planetary Health Eastern African Regional Hub? Our vision is to focus on advancing local community building and also public education and student community education and policy. And some of the activities that we've been planning to do and some we've already done is hosting workshops, seminars and meetings, organizing and leading interventions on environmental and health issues, and also influencing policy and also building public awareness of planetary health challenges, and also developing educational curricula and learning resources, and also developing networking opportunities among students and individuals interested in planetary health. And what is the COVID-19 situation in Africa rather? We see that COVID-19 has highlighted a long-standing crisis of inequality between communities in the Eastern African community. We find out that many women have faced a lot of challenges during this crisis as compared to the male gender. So that's just a picture showing women in hospital taking their kids, but at the same time they have to undergo checkups. And then we also work on the other serious crises which continue to be caused by the transgression of planetary health boundaries in Eastern Africa. Those are my details, and thank you so much for listening to my short presentation. And I will hand over to Laura so that we can welcome Dr. Sam Mears.
Thank you, Melvine, for giving those insights on planetary health in the Eastern African region, but also what the opportunities are, especially for young people to engage and to get active and to move us all towards a more healthy future. At this point, I now welcome Sam Myers from the Planetary Health Alliance, who is, I think, going to introduce himself and giving us a first introduction to the topic that we haven't had yet. So welcome, Sam, and thanks for joining at this more early time for you.
Well, what a pleasure to get to be here, and what an important event to have the launching of the Eastern African Planetary Health Regional Hub. I guess what I'll do is provide a little bit of a broad kind of introduction to the field of planetary health. So, planetary health really has emerged out of this, I think, unique moment in human history where, by most metrics, there's actually never been a better time to be a human being. In the last 70 or 80 years, we've seen these really extraordinary improvements in most metrics of human development. So, The percentage of the adult population around the world who can read and write has risen from 42% to 86%. In 1950, there were 1.6 billion people living in extreme poverty and only 920 million people who were not in extreme poverty. And by 2015, there were only 730 million people living in extreme poverty and 6.6 billion people who were not. So in that period of just about 75 years or 65 years, the percentage of the global population living in extreme poverty dropped from around 62% to around 10%. Life expectancy has risen very dramatically over that same period of time, from an average of 46 up to 72, and child mortality has dropped by a factor of 4, from 225 to 45 deaths per 1,000 births. But the same really sort of extraordinary scientific and technological developments that have fueled these impressive improvements in education and wealth and health across the global population in really just one person's lifetime have also been fueling this extraordinary expansion of humanity's total ecological impact on our planet's natural systems. And so if you look at these metrics of human consumption over time, whether you're looking at our appropriation of water resources, or the proliferation of motor vehicles, or the production and use of synthetic fertilizers, or paper or plastic production, or our primary energy use, you see these very similar patterns where there's a relatively modest consumption pattern. And then in around 1950, you see this steady rise and then this very, very steep, almost exponential growth in our global consumption patterns. And not surprisingly, if you look at our impacts on our planet's natural systems, you see very similar curves, whether you're looking at global biodiversity loss or exploitation of our fisheries or addition of carbon dioxide to the atmosphere, the acidification of the oceans, or the loss of tropical and also temperate forests. And the reason that all of these graphs look so similar is that they're all underlain by these two really fundamental trends. One is the growth of the human population. And again, it was very steady for most of human history, started to rise around 1900 to 1950, and then this really steep acceleration in the growth of the human population. And that's been coupled with an even steeper increase in per capita GDP and the amount of goods and services that each one of us is asking the planet to provide for us. And when you multiply the fact that we have so many more people and that each one of those people is asking for so many more goods and services, you get this really extraordinary increase in the total human GDP and the net sum of all of our economic activity, so that we're sitting on this almost vertical line today of increasing consumption globally. And it's really hard to overstate the sort of total impact of that ballooning of our ecological footprint. So every year now, in order to feed ourselves, we've converted about 40% of the terrestrial land surface for just croplands and pasture. We use about half the accessible fresh water on Earth, mostly to irrigate our crops. We're fishing 90% of our monitored fisheries at or well beyond maximum sustainable limits. We've cut down between 7 and 11 million square kilometers of the world's tropical and temperate forests. We've dammed over 60% of the world's rivers, and that is on the way to 92% over the next several decades. As Melvine mentioned, we're suffering from global challenges around air, water, and soil pollution. And as you all know, we're disrupting the global climate system. And as a result of all of these kinds of changes in natural systems, we're driving the world's species extinct at about 1,000 times the baseline rate. We've already lost around 65% of the mammals, fishes, birds, reptiles, and amphibians that used to share the planet with us about 50 years ago. And about 1 million species are now facing extinction, many within the next several decades. So the scale of the human experiment, the scale of all human activity on our planet has just had this massive ballooning. And the sort of core premise of planetary health is that the scale of human activity now exceeds our planet's capacity to absorb our wastes or to provide the resources that we're using sustainably. And as a result, it's not just climate change, it's everything change. We're driving the sixth mass extinction of life on Earth. We're dealing with these huge issues around air, water, and soil pollution. We're changing biogeochemical cycles like the nitrogen and phosphorus and carbon cycle. Land use and land cover are changing rapidly. That's particularly true in Africa. We're dealing with resource scarcity of things like fresh water and arable land, and we're disrupting the climate system. And all of these sort of large-scale, human-caused transformations of our planet's natural systems are interacting with each other in complex ways that we're only just starting to really understand to affect the core conditions for human health and well-being, the quality of air that we breathe, the quality and quantity of food that we can produce, access to fresh water, exposure to infectious diseases, exposure to extreme weather events, even the habitability of some of the places that we live. And the result is that these environmental changes writ large across the globe are affecting just about every single dimension of human health. And so just as we've come to understand that there are really important social and cultural and even political determinants of human health over the last few decades, we're now coming to understand that there are also very important ecological determinants, and that in fact human health is nested in a set of ecological conditions, and that we are now changing those conditions at the fastest rate in the history of our species. So the area where I do most of my own research is in the effects of global environmental change on nutrition. As you can see, there are multiple different ways that changing biophysical or environmental conditions affect quality and quantity of food production. I've been doing research in three primary areas. One is showing that as we add carbon dioxide to the atmosphere, when we reach levels of CO2 that we expect to reach in the middle of this century, our food becomes significantly less nutritious, that staple food crops like rice and wheat and maize are losing important amounts of nutrients like iron and zinc and protein. And when we look at how that will affect the sufficiency of intake of those nutrients for the populations of 152 countries around the world, what we find is that between 150 and 200 million people are likely to get pushed into new risk of things like iron and zinc and protein deficiencies just as a result of the carbon dioxide that we're adding to the atmosphere. We've also been working on how declines in pollinating insects are affecting the yields of pollinator-dependent crops and what that means for human health outcomes, because a lot of those crops are things like fruits and vegetables and nuts and seeds and legumes, which actually provide a really important role in protecting us from non-communicable diseases like heart disease and stroke and certain cancers and diabetes. And so when we don't have enough of those foods, we see very large health effects. And then the last area is looking at fisheries and ocean warming. And we're seeing that as ocean temperatures warm, we see these big shifts in the distribution, the geographic distribution of where the fish are located, where fisheries start to migrate away from where you are in the tropics and toward the poles. And that there also are changes in the size of fisheries. And that affects the health of around 1 billion people who depend on wild harvested fish to get adequate amounts of nutrients like omega-3 fatty acids and vitamin B12 and iron and zinc in their diets. And so there are around 1 billion people who are getting important contributions of those nutrients from wild harvested fish and are living close to a threshold where if they lose that contribution, they're at risk for becoming deficient. So those are areas where I do research. But again, these are just sort of a small snapshot of some of the major issues around changing environmental conditions and human nutrition. Another place that we work actually is in East Africa and Madagascar, where we've been looking at how losing access to wildlife in the diet from bushmeat hunting actually affects the nutritional sufficiency of populations in northeastern Madagascar. But of course, there are lots of other issues around how growing scarcity of water resources, arable land degradation, growing population displacement as people are being forced to move, pollution of both air and soil that affects food production, and other kinds of surprises. Lots of things that are hard for us to anticipate right now as we're changing all of these biophysical conditions. All of these different mechanisms that can affect the quality and quantity of food that we produce, and therefore nutritional outcomes around the world. And of course, nutrition is just one dimension of human health, but we could have equally complex sort of conversations about each of the other major dimensions of human health. So let me just give you a really quick snapshot of that. Melvine spoke about the COVID-19 pandemic. Clearly, that's one example of how really a very risky relationship that humanity has developed with wildlife populations has come back to affect us, in this case through these live animal markets in China. But there are many other ways, as you know, where we're seeing these spillover events between wildlife populations and human populations, where these zoonotic infectious diseases are able to move out of wildlife populations and into human populations. Many of them have already occurred in Africa, as you know. And as we change these environmental conditions, it's not just our relationship with wildlife populations, but climate change is affecting our exposure to infectious diseases. In Africa, things like deforestation are associated with malaria. As you know, in Kenya, as it gets warmer in the East African highlands, we're seeing more malaria at higher altitudes. We're seeing in particularly West Africa that with dams, we see really high incidence of schistosomiasis coming back into areas where it didn't used to be. So there are lots of different ways that changes in land cover, climate, or the biological composition of communities all can affect our exposure to infectious diseases. In this example, these farmers in Belize are adding fertilizer to their fields to improve their crop yields. What they don't know is that the nitrogen and the phosphorus that they're adding to their fields will run off from the fields into small streams and accumulate in larger streams and rivers and flow hundreds of miles down into lowland Belize, where it enters these wetland systems that you see at the bottom picture. And the addition of these nutrients of nitrogen and phosphorus actually can trigger an ecological shift where you get a different kind of vegetation. And these typhal vegetation that you see here, these sort of reedy vegetation types, transition to a different kind of typhal vegetation, which turns out to be a better habitat for a different Anopheles mosquito. And so you start to lose the habitat for Anopheles albuminus, and you see more and more Anopheles vestipanus. The problem with that is that Anopheles vestipanus is a very effective malaria vector for humans. And so, unbeknownst to these farmers up in upland Belize, their addition of fertilizer to their fields is actually putting their lowland compatriots at higher risk of malaria through this complex ecological set of shifts. And in fact, when this has been studied across 6 different continents, it turns out that this is the case much more often than not, where addition of these nutrients to these natural systems can lead to increased infectious disease exposure. So many of these effects are somewhat surprising. Not all of them are intuitive. Another area of real concern is population displacement. And obviously in Africa, this is a major concern, that we're seeing the highest numbers of displaced people in the history of our record keeping. Last year, there were around 66 million displaced people. About half of those are children. And they're being forced to move for a whole complex variety of different reasons, but often at least one factor is changing environmental conditions, severe droughts, crop failures. In some parts of the world, we're seeing coastal populations at risk from sea level rise and more extreme weather events. And around the world, there's a lot of concern that as we destabilize our natural systems, that certain parts of the world will become, at least temporarily, uninhabitable, and people will be forced to move. And when they're forced to move, often they're not welcome in the places where they end up. And so that can be a source of increasing conflict. We see malnutrition, we see infectious disease epidemics, we see physical, sexual, and psychological trauma in displaced populations. And so there are very large health effects of these forced migrations or displacements. Another dimension of human health that's affected by environmental change is non-communicable disease. And Melvine mentioned pollution in East Africa. There was recently a big Lancet commissioned report on global pollution and health. They concluded that we're seeing around 9 million excess deaths every year as a result of pollution of air, water, and soil, and that most of those deaths are non-communicable diseases, things like cardiorespiratory disease, certain kinds of cancers, heart disease, and strokes. And a lot of that is from air pollution, but also from soil and water pollution. But there are other kinds of environmental changes that are also affecting non-communicable diseases. As I mentioned, the loss of pollinating insects is taking foods out of our diet that help protect us from those diseases. Changing the composition of nutrients in our grain as a result of rising CO2 actually is putting us at higher risk of heart disease. In this picture in Bangladesh, we're seeing more and more intrusion of salt water into coastal aquifers as a result of sea level rise, more extreme storms, and poor water resource management. And we're finding that the amount of salinity in the coastal groundwater that these people are drinking is very closely correlated with the risk of preeclampsia in pregnant women and also hypertension in adults in Bangladesh. And so again, a surprising finding that climate change would drive sea level rise, would drive salt water into these coastal aquifers, would create more preeclampsia in pregnant women in Bangladesh. But these are the kinds of sort of system-wide effects that we start to see. And finally, we're concerned about significant mental health effects of changing environmental conditions. And, it's fairly intuitive that these major disasters, things like the huge locust outbreak in East Africa last year, or the fires that we're experiencing in California, or the hurricane season we've had this year in the United States, that these things are associated with enormous amounts of anxiety, depression, sometimes suicidality, loss of jobs, and that there are huge mental health burdens. But we're starting to wonder more about the subtler effects as well. What is the burden that we all carry of knowing that places that we love and cherish are changing in front of our eyes, that places that are of deep cultural importance to us are no longer going to be part of our family story? What is the burden of knowing that our consumption patterns are actually putting the poorest people in the world in harm's way? And that's an area where research really still needs to be done. But I believe that there are going to be very significant mental health burdens of these environmental changes as well. So when you think about this big picture, the story I'm trying to tell you is that the scale of human activity has gotten so large that we're really transforming all of our natural systems at a very alarming pace, and that those transformations are coming back to threaten our own health and well-being. And so when you think, well, so what do we do about this challenge? I think the answer is we need to go back upstream and look at what are the root causes. And the root causes turn out to be how we're living on Earth, and pretty much how we're doing everything, which is what's changing our natural systems. And so we really need a course correction, sort of the way that we're headed. Humanity is headed in a very dangerous direction where we're undermining the core life support systems that we depend on. And so we need to take a different trajectory. And one of the things that I think is really important to share with friends and colleagues is that there's a very bright future in front of us. There's no reason why, our grandchildren can't live in a world where human population has actually stabilized and is starting to fall, not because of any kind of coercive practice or disaster, but because we're educating girls better, we're providing more economic opportunities for women, we're providing couples who want access to contraception, we're providing them access, and as a result, the population is starting to stabilize, that we've moved to a post-combustion energy economy, and we're not relying on fossil fuels any longer, and we're starting to get climate change under control, where we're finding these massive efficiencies in how we produce our food and our goods and services so that they have much lower ecological footprints, where we're living in cities that are designed to really maximize our physical and mental health, but to minimize our ecological footprints. And that, with every passing decade, there's actually more breathing room for the rest of the biosphere as a result. And we call that process the Great Transition, that we're sort of trying to move toward this great transition where we're doing everything from food production to energy production to manufacturing and the economy, circular economy, to green chemistry, where we're doing all of these things differently. And the good news is that we know a lot of what we need to do already. So we have a lot of solutions available to us. I think in some ways in Africa, because so much of the world's population growth is occurring there, and because cities are growing fast, there's an enormous opportunity for leadership in Africa in designing the world's future cities, in leapfrogging some of the technologies that have gotten us in the global north into trouble, in finding new ways to think about food production that include both sort of traditional things like agroecology, as well as things like precision agriculture and some of the more innovative technologically based solutions. And so there's an enormous opportunity, whether you're working in urban design and the built environment, or food systems, or energy, or business and the economy, to come up with solutions that are more in line with this great transition. So obviously, we welcome all of you to be part of the Planetary Health Alliance. We have our big annual meeting, which will be virtual, that's coming up in April, and welcome anybody to participate. And if people are curious about any of the things that I've been talking about, our book just came out on planetary health. It will be available in Europe starting at the end of this month, and is available in electronic copies as well.
Thank you very much, Sam. And we have a few questions for you coming in, and then also a few discussion points I think that we can answer together. So let me start with the more specific questions on your presentation. So the first question was, what are the major nutrients that are affected most due to the increase in CO2? And then followed by the question that I think is related, what would be some of the nutrition outcomes that we may have to look out for if the CO2 increases more? So I think that's then the bigger picture to this.
Sure. Well, so this is research that I've been doing for about 10 years, and the nutrients that we looked at that are most concerning are the loss of iron and zinc and protein. And all of those nutrients are really, really important for human health. And when you don't have enough iron, you see reductions in IQ, in intelligence for children. You see higher risk of maternal mortality, higher risk of neonatal mortality, so pregnant women who become anemic and have a higher risk of complications, as well as their infants. You see children with stunting. And so there are a lot of effects of iron deficiency. With zinc deficiency, you see significantly higher mortality rates, particularly in children from infectious diseases like malaria, pneumonia, diarrhea. And so, the outcomes really have to do with higher risk of mortality. And this is just, that's just one example from my research. There are a lot of other ways that changing environmental conditions are, particularly climate change itself in East Africa and Africa more broadly, really threatens global food production. And, in terms of things to do about it, there are a lot of different things. There's no sort of silver bullet. So, one thing is dietary diversification. So eating other kinds of foods that are rich in those nutrients and trying to stay away from diets that rely only on one staple food, but having more fruits, vegetables, nuts and seeds, those kinds of things in your diet is really helpful. There are opportunities for biofortification, and people are doing research now to create crops that are just naturally more rich in those nutrients. There's opportunity for breeding crops that are less sensitive to this carbon dioxide effect. There are opportunities for fortification of diets with extra nutrients. So there are a variety of things that are possible, but the bottom line is that nutrient deficiencies like iron and zinc deficiency have been affecting between 1 and 2 billion people around the world, many in South Asia and sub-Saharan Africa. And they've been affecting people for decades. And so none of the solutions I'm talking about is going to fix the problem completely. And a lot of it is having more diverse diets and trying to reduce the amount of CO2 in the atmosphere over time.
Thank you for this, I think, very good answer to the question. And then we have 2 more questions that are going a bit in the same direction. So I'm gonna just read them out together. So one of them, and you have already touched a bit on this, but maybe you also want to go a bit into the risks, is the question if the production of genetically modified food is a threat to the population and the environment, or if it can be an opportunity. And this then goes together with a comment from another participant that said, a new nutritional culture, meaning new diets, may lead to an unsustainable agriculture, and again, lifestyle changes like new enhanced use of technology may lead to an overexploitation of natural resources, for example, the land, to meet these new demands. This is especially so in Eastern Africa, where other sectors of the economy are poorly developed. And this should just be a comment for us to think about within the planetary health context. So Sam, do you have ideas on this?
Yeah, so there are a few different questions there on the question of genetically modified organisms. Is it a threat or is it an opportunity? I think, to some extent it's both, but I think that the threat tends to be slightly overstated, at least in my world in Cambridge, Massachusetts. I think that the wealthier nations in North America and Europe in particular, there's been a very strong movement against genetically modified organisms, especially in Europe. And while I understand that instinct, I also think it's a little bit risky because we have 850 million people in the world who go to bed hungry even today. Those numbers have been rising over the last 3 years. I'm very concerned with all of the different environmental threats that we face, that those numbers may get worse. And so I think that we should be very careful about making categorical decisions that we're not going to use genetic modification when it may mean people going hungry. I think that we need to do a lot of very careful assessment of whether there are risks, and we need to have systems for evaluating genetically modified crops. But the fact is, we're using genetically modified organisms in the pharmaceutical industry and in other instances, and we have never had an example of a major health concern coming from that. So I'm very reluctant to say, we should stay away from genetically modified organisms when that might be one of the answers that helps feed people who are going hungry and who are at risk in the future. In terms of new diets, I think new diets are both, again, a threat and an opportunity. There's been a global transition to sort of Western style diets. And as we've seen places like Sub-Saharan Africa and South Asia become wealthier, which has been a wonderful trend, we've also seen a lot of our bad habits in the global north start to permeate in terms of diets. And so as we see urban populations eating more saturated fats, more sugar, more meat-based diets, we're seeing increases in heart disease and other non-communicable diseases, as well as obesity, diabetes, and all of what we call these metabolic diseases. And so it's sort of ironic because in places like Cambridge, Massachusetts, where I live, there's a big movement to transition back to plant-based diets and to eat diets in whole grains and eat essentially diets that look a little bit more like what traditional diets looked like in places like sub-Saharan Africa and South Asia a long time ago. So there are some huge health benefits to moving back toward those kinds of more plant-based diets. That said, in places like sub-Saharan Africa, in general, there's still probably not enough animal source foods in the diet, particularly for poorer populations. And so having access to eggs and milk and some meat in the diet would actually improve things like iron and zinc deficiency. So it's a more complicated situation in the global south than it is in the global north. In terms of the last question about sort of technology and overexploitation of resources, particularly around agriculture in East Africa, I think there's no question that there's a risk there. It's part of what I was describing earlier on of this sort of ballooning of our global footprint. And our technologies allow us to have even larger impacts. It's also true that there's an opportunity for real leadership in figuring out how to increase food production in places like sub-Saharan Africa while minimizing the ecological footprint. And so there are principles from, for example, precision agriculture, where we're using a lot less fertilizer, pesticides, water, and even energy and land to produce the same amounts of food because we're doing it in a much smarter way. And so I think, really having some thought leadership in, the universities and the agricultural ministries to think about how to be most efficient with our use of environmental resources so that you can still have an agricultural economy, but be protecting your natural systems at the same time, that there's a real opportunity there.
Amazing, thank you. Adding to this, there is a question on land use and the role that wetlands can play in climate change mitigation and how those compare to forest lands.
Yeah, that's a really interesting question. I'm not an expert in sort of carbon sequestration in wetlands versus forests. I know that I do work in Indonesia where we're seeing that peatlands are being drained and then burned to clear land for agriculture, and that's a huge problem with respect to both human health because of the particulate air pollution, but also carbon emissions because there's just an enormous amount of carbon stored in peatlands. Essentially, it's almost like coal. It's all of this fossilized plant material, and it goes very deep and it burns for a very long time. But in non-peatland wetlands, I don't know how rapid the sequestration is. But what I do know is that wetlands play, enormously important other ecological roles. So it's not all about carbon sequestration, right? And from the standpoint of protecting biodiversity, filtering water to provide cleaner water, providing barrier systems. So I talked about the risk of coastal populations, and often these wetland systems are sort of between the ocean and the mainland, and you see things like mangrove forests and inland wetland systems that actually provide a buffer from severe weather events and flooding. And so these wetlands have a lot of other functions besides carbon sequestration, and it's important that we start to protect them more effectively.
Thank you, and yeah, very good to highlight that biodiversity also plays a role here. I have one last question for you on like this agricultural field, and then we can move to something a bit more different. So that one is on the decline in insects who act as pollinators and how that can be handled in Eastern Africa for a healthy planet future.
Well, it's a really interesting question, sort of what to do about the decline in pollinators. And it's an area where I'm doing a lot of research right now. There's a wonderful pollinator ecologist who lives in Argentina named Lucas Garibaldi, and he's one of the world's leading ecologists. And the pollinator ecologists have been coming together as groups for a while and have defined a series of what are called pollinator-friendly practices. And they've agreed on these practices and on their effectiveness. And there are things like planting certain flowering crops in hedgerows between the fields and protecting natural forest and barrier systems, providing forage for pollinators, and they make a big difference. And his research has empirically looked at farms, including farms in Africa, as well as on 3 other continents, and shown that about a quarter of the yield gap, the gap between the best performing farms and the average farms, about a quarter of that gap is from not having enough wild pollinators around. And so, in fact, engaging in these pollinator friendly practices can improve yields enough so that they really pay for themselves, and they often make a lot of sense economically. We've also been analyzing the economic costs today in certain countries around the world of not having enough pollinators, and we're finding these very large costs. So it's very expensive to let your pollinators decline, and so it makes a lot of sense on the policy level, both in terms of protecting the health of your population and also in terms of protecting your economic activity, to try to find ways to protect your pollinators. Essentially, they're all free laborers, right? And they're out there working on your farms for free, and they're increasing your yields. And so if we lose them, that's a significant loss. And so we're actually working on a paper right now that's a global analysis of the cost that we're paying from not having enough pollinators around.
Thank you. And I think that's a very good point that we know from the health world as well, that prevention is a lot cheaper than treatment. Talking about health, we also had a question coming in that was on health professionals and how we could mobilize them better for the necessary changes.
Yeah, I love that question because I'm a physician myself. So, we've had a lot of people that are clinicians, that are doctors and nurses and traditional healers and midwives and pharmacists who are interested in how they personally in their practice can advance planetary health. And as a result of all of that interest, we created a whole new initiative at the Planetary Health Alliance that we call Clinicians for Planetary Health. And so we invite anybody around the world to come and participate. It's a community that's already includes people from all over the world. There are over 750 really active participants, and we have regular meetings. But one of the things that we're trying to do now, and we would love to have help from our East African colleagues, what we're trying to do now is create patient-facing materials so that if you think about it, actually, the most trusted profession in the world is nurses. It's been the most trusted profession in the United States for the last 17 years. And if you do global surveys, nurses and firefighters are the 2 most trusted professions, and doctors are somewhere right below nurses. And so we've been thinking about how to use the fact that we have these trusted messengers to help people understand these connections. And so we're developing these patient-facing materials so that when patients come into a clinical setting, maybe it's a little brochure that they see while they're waiting to see their clinician, or maybe you have a little button that says, ask me about planetary health, or maybe there's something on the door, but it's an opportunity to educate patients about the things that they can do that are very good for their personal health, but that are also good for planetary health. So things like more vegetable-based diets, walking and biking instead of driving to work, thinking about your energy sources that are non-polluting, so renewable energy sources. But there are a lot of things like that that are good for us, but they're also good for planetary health. And so we're hoping that clinicians can play a role in helping to get that message out to people.
Thank you. And very good hint that a lot of things that are good for our own health are also good for the planet. From this coming to a very more specific health risk, and that is the recent locust invasion in Eastern Africa. And the question is if that might have any links to climate change or loss of biodiversity, and if there is any technology that could prevent such misfortune in the future.
Well, I think somebody's defined a really lovely research question, and I'd like to see them actually answer it, because I don't know the answer to that. I've read people saying that it was the worst locust outbreak in 70 years and that there was an important climate signal. There are important climate elements to it, but I don't know whether that's really true or not. I haven't seen the data. And I think that these are the kinds of, that's a beautiful example of a planetary health research question. There's similar questions. People have asked whether the Syrian civil war and the subsequent refugee crisis that we've seen has had a climate component. And what we know is that it was preceded by the worst drought in the history of the instrumental records. We've never seen a worse drought, and that is very consistent with climate change. And so it seems like there's a climate signal for that. But these things are obviously quite complex, so it's not a single factor. But yeah, I would be quite surprised if there weren't environmental factors for something like a locust outbreak being so severe in East Africa. And I don't know, we don't have locust outbreaks where I live, so I don't know much about what the right way is to handle that in the future. I don't know whether a more biodiverse system would have been more resilient to that. I don't know if they're predator species, whether it's birds or other species that would have helped to control it more quickly. But those are all really interesting questions that I think would be great for someone to work as a research project.
So yeah, great. Amazing question. If anyone knows, hit us up. We are all interested in the answer. And then we have one question that I think you're probably hearing a lot, but it's also a quite central one for understanding. And that is, what are the actual differences between planetary health, One Health, and global health, or are they actually complementary?
Well, I think it is an important question. I think there are differences, and I think they are complementary. So I think that, first of all, One Health, Eco Health, and Planetary Health are all interested in different ways in the health of animals, humans, and environment. Global health, to me, is kind of the big umbrella that all of that falls underneath. So, planetary health fits under the umbrella of global health. Global health thinks about lots of other things like vaccination programs and seatbelt laws and smoking cessation programs and prenatal care and things that are just part of good, international health. Whereas planetary health is focused on understanding the human health risks associated with global environmental changes. And so it's kind of a subset of the larger global health umbrella. One Health and Eco Health are sort of more like cousins, I think, of planetary health. One Health is a field that's come out of the veterinary community historically. If you look at journals of One Health, or you go to the meetings and you look at abstracts, the kinds of things that the community talks about, it's really very, very focused on zoonotic infectious diseases, on infections that come from animals into human populations or vice versa. And so in that sense, I see One Health as kind of a sub-segment of planetary health. There's less focus on things like climate change and nutrition or on other drivers of infectious disease like deforestation or the dams in West Africa, less focus on things like population displacement or the mental health effects or the non-communicable disease effects. So it's really more narrowly focused on zoonotic infectious diseases. And eco-health, I think, is a closer cousin in some ways. I think what distinguishes planetary health, maybe as Melvine was saying at the beginning, is this issue of scale and urgency, that planetary health has really come out of this sense that the major driving force for the global burden of disease over the next century is likely to be our own transformation of natural systems, so that it's going to be very hard to have a healthy human population over the next century if we can't start to protect our biological life support systems. And so there's a sense of the urgency and the scale of the problem that we face that's a little bit different in the DNA of the field of planetary health.
Thank you. I think that was a very accurate description of planetary health. And I have a last question for you, that someone saying that the planet is surely changing, and that for the worse, and that the majority of those contributing towards this and are also suffering from the consequences are either ignorant or don't care at all. What is your take on this? I think your last slide had been a bit more optimistic than this statement, so we would be interested in hearing thoughts.
I'm glad you asked that question, because I think there are a couple of parts to it. One thing that's really, really, really important to acknowledge is that the people who are driving a lot of the health threats in planetary health are often very different populations than the people who are most at risk for those health threats. So for example, we wrote a paper a year ago that was sort of an environmental justice paper, where we looked at who are the people around the world who will be responsible for most of the carbon dioxide emissions that take us to 550 parts per million by the middle of this century. Which people are responsible for those emissions? And then we looked at who are the people around the world who will suffer from the micronutrient deficiencies as our food becomes less nutritious. And the people at risk are the people in sub-Saharan Africa and South Asia, primarily because of the kinds of diets that they have, and because there's less animal source food in their diet and they're less diverse diets. And the people who are emitting the carbon dioxide generally are in the global north and are the wealthiest populations in the world who are consuming the most. And so there's that fundamentally that's deeply unfair, right? So there's a moral dimension to a lot of these planetary health arguments. And I think in general, when you look at in West Africa, who are the people that benefit from a huge dam project? And there are big benefits, right? There's electricity, so you have clean energy, you have water for irrigation. But when you look at who gets those services, and then you ask who suffers from much, much higher rates of schistosomiasis when they go down to the water to get their community water, it's people that can't afford shoes, that are barefoot in these water systems. It's often rural village populations. And so there's a disconnect between the people who are getting the benefits from changing the environment and the people who are paying the price in the health burden. And so I think that's just always important to be focusing on. In terms of people not caring, I think it's a little bit more that there often are benefits. We don't engage in the activities that are transforming our natural systems without a reason. And the reason is often that it benefits somebody. Now, often it benefits exploitative industries like the fossil fuel industry or mining companies or logging companies. And it's very simple and very cynical, which is we're going to profit and we don't care that it's putting other people in harm's way. And those are problems that Marshall Gans calls power problems instead of knowledge problems. It's not that we don't understand them. It's that somebody's got the power to do it, and they're busy lining their own pockets, and they don't care that it's harming other people. And the only way to address power problems is by organizing and movement building, and holding governments and industries accountable. And so that's where things like the school strike movement and all the work that's going on around the world to organize people, what Melvine's doing, and all the organizing that we need to do around the world to keep these special interests from damaging the environment. So I think it's not that it's just people are ignorant. I think that when people don't understand, there's an opportunity for education and for bringing people together. Things like the Clinicians for Planetary Health effort that I was talking about. When people already understand, but they don't care, then you've got a power problem. And that's where you really need to be organizing social movements.
Thank you. I think that was a very important stance as well on power and privilege and inequities that are leading to the situation that we are seeing right now. Maybe as like a last outlook, do you want to give us a bit your ideas for a healthy recovery from also the COVID pandemic that we are seeing right now that Melvine had touched a bit on her last slide?
Yeah, well, I mean, I'm keeping my fingers crossed in the United States that in the next day or two, we'll discover that we have a new president who's actually interested in a healthy recovery. I think the real leadership in the world right now is coming from Europe more than anywhere else. And I think when you look at the European Green New Deal, there's this extraordinary opportunity in front of us. I mean, COVID-19 has been a tragedy around the world. And it's been a tragedy because of lost lives and lost livelihoods and the economic depression that's followed. And it's really important not to downplay that. It has also been a very interesting event and opportunity. It's shown us that global scale, collective behavior change is possible in a very, very short time frame. And we've seen the whole world change the way we live, the way we work, the way we gather at really a remarkably fast pace. And that kind of behavior change that we've never seen before in history. And it's just that kind of behavior change that we're going to need to start addressing the world's planetary health challenges. We've also seen that nature recovers. And that when we stop driving our cars all over the place, the air quality gets much better. And we're starting to see animals come back into habitats where they haven't been seen for a long time. And so that's actually pretty exciting to see that nature can recover when we treat it a little bit better. And then there's this enormous opportunity that you're talking about with these stimulus packages. And the Biden administration and his campaign have talked about a $2 trillion program on energy and building the green infrastructure that will be needed with a focus on anti-racism and on building renewable energy technology and creating jobs. The European Green New Deal focuses on many of the same things and is very broadly conceived. It's not just climate, but it's biodiversity, inclusion. In fact, I was speaking yesterday to the European Environmental Agency that's talking about what they're going to be doing. So I think there will need to be foreign assistance packages for some of the countries that don't have the financial capacity to withstand this pandemic, where countries in the global north are going to be having to develop some foreign assistance packages, and that those packages and our stimulus packages all need to be framed around building what we call the great transition, around building the world that we need instead of propping up this sort of crumbling old system that's choking the life out of the biosphere. So we need to be investing in the new food production systems, the new energy systems, the new manufacturing systems that are going to allow us to live more lightly on the planet.
Thank you very much, Sam. And I think that's actually what we are all here for, to build the world we need. Thank you very much for joining us today. And I think you're as excited as us seeing the planetary health movement growing to the places where it really matters. And I'm just going to share my screen for last time to show you what the next activities are that we're planning within the hub. So this was the introduction lecture of a series of 4 lectures that are coming up in the next few weeks until Christmas, and we are hoping to having you join for the next lectures as well. In fact, the next one that we are seeing is in 2 weeks, and it's on the Eastern African challenges and opportunities on the way to planetary health. And we have 3 amazing speakers joining us from Kenya, from Germany, and from Zambia. So we are really looking forward to see what planetary health means in the Eastern African context. And we have another very exciting opportunity coming up, and that is a workshop in mid-December on transformative planetary health action. So if you're interested in engaging more in a conversation, then this is possible now in a webinar like this or in our lectures, then you should very much sign up for those workshops that are, I think, also a bit more intense than what we have done right now, but that are really going to work on plans for a healthy future.